dental hygiene student who's kind of confused about the different types of seizures? Open up your textbook and let's talk about it. Today's source is Preventing Medical Emergencies in the Dental Practice, 3rd edition, Pickett. It's going to be chapter 12. So seizures are basically categorized into focal and generalized. Focal means one part of the brain and generalized means both. In a focal seizure, there is an aura. And what is an aura? It's basically a little warning sign that happens before a seizure. A focal seizure or partial seizure is separated into a simple and a complex. With a simple seizure, the person stays aware. They may feel tingling, can see flashing lights or smelling odd odor, or even kind of like a feeling of deja vu. Complex, their awareness is a little impaired, so they may stare blankly, perform repetitive movements like lip smacking or fidgeting. So in simple, they're still aware, and complex, they're a little confused. So generalized, like I said, it is both sides of the brain. These ones are known as your tonic-clonic or grand mal, like I'm gonna have a grand mal seizure. And absent, which is a petit mal. You have myoclonic, atonic, and staticus epilepticus, which is one of the most dangerous ones. Back to tonic-clonic, like the grand mal seizure. This begins with stiffening of the muscles. The jerking, which is the clonic, they may lose consciousness. Bladder or bowel control kind of gets lost. Recovery includes confusion and tiredness, and they also might have that kind of like yelling. There is an epileptic cry, which is basically the muscle constriction of the vocal cords. So they kind of like yelp out a cry. It's not because of pain, it's just because their vocal cords are kind of constricting. So you have that absent seizure, which is the petit mal. These are very brief lapses of consciousness. This can often be mistaken as daydreaming, and this is common in kids. Do you know the medication used for the absent seizures? If you said ethosuximide, you are correct. Now we have myoclonic. These are quick and sudden muscle movements and like jerking. These are not going to be something that you need to have an emergency for, but just make sure things are out of the way and careful that they don't hit anything. Atonic is sudden loss of muscle tone. Head kind of just drops or they collapse, and it can be a risk of injury. Okay, and lastly, we have status epilepticus. This is an emergency. If this lasts more than 3 to 5 minutes, you need to call 911. So a way to remember these are going to be tonic, tense, clonic, convulsion, absence, blank stare, myoclonic, muscle jerk, and atonic, all tone gone. All right, and that's the quick little review. Now you know what the different types of seizures are and how to recognize them, and have fun studying. I'll see you later. Bye.